Today's topic, Behind the Curtains, Life of a Psychologist. Welcome everyone. Today I want to talk about something that's often overlooked in the world of mental health, the inner struggles of psychologists themselves. We often assume that psychologists, because they help others, don't face their own mental health challenges. Do you think that they don't have problems or mental health issues? They do. Do you think they themselves don't have anxiety or depression or any mental illness? Sometimes they do. Do you think they have not fallen in love and have broken heart? Sometimes they have. Do you think every day for them is a perfect day? No, it is not. Do you think they themselves have not gone through any situations or turmoils or have gone through any dynamics or dramas? Yes, they have, of course. One of the famous writers has mentioned that artists cannot be a good artist and writer cannot be a good writer till they themselves have gone through some pain, emotions and struggle, which I agree to. Same as with the psychologist. A psychologist cannot be a good psychologist till they have gone through their own emotions. And as it is, creativity, when it comes to creativity, you're your own guru or your own teacher. Society often expects a psychologist to be completely balanced, calm, and in control, forgetting that they are human beings with emotions and feelings too. This perception puts immense pressure on the psychologist. The perception makes the psychologist to walk on the tightrope of being on a pedestal of success, and at top being judged and being watched from below. Here she falls, here he falls, here, there we go, she finally falls. And they're watching from the below, waiting for the psychologist to fall. For many psychologists, the idea of seeking help for their own mental health feels like a sign of weakness and vulnerability. They hesitate to visit another psychologist, reveal their secrets and struggles, and ask for help. The fear of being judged by the colleagues, friends, and even family holds them back. Psychologist's job is to purchase and buy out and absorb and sink in the pain and emotions of their patients, which can impact their own mental well-being. When a psychologist connects deeply with a patient, it's sometimes impossible not to mirror the patient's emotions. And I will lie to you all if I said I haven't teared up or cried while sitting with my patient, feeling their pain as my own. I cannot be perfect and I cannot be a robot, and I don't want to have a mask over myself when I'm connected to my patients. I have trained and treated many psychologists and counselors in my practice with mental health issues and for professional development too. Let me share today a few stories. Once I came across a fantastic app designed for people with borderline personality disorder, that's BPD, created by a psychologist who had been a BPD patient herself until the age of 26. By the time she created the app, she was in her 50s and had become an expert in treating people with BPD. She explained very well that her personal experiences with the disorder made her a more empathetic and effective psychologist, and I could not agree more with her. One of the other psychologists I treated, she herself had gone through emotional abuse in her past life in young age. When she became a psychologist, she realized that she had gone through treatment, and her innate anger and reactions towards the abuser were coming out in the sessions when she was treating the patient. When she went through the treatment, she mentioned that self-reflection made her a better psychologist to treat people who were abused, and I had to agree with her. Another story is of a counselor who was herself going through panic attacks and anxiety, and she was treated successfully with cognitive behavior therapy, that's CBT, and now she is following the model successfully to treat her own patients. And after the treatment, she agreed with that she was putting a band-aid and masking her issues with irregular medication, not understanding from where her problem came from, which was causing interference in treating other people. So awareness caused by the psychologist and self-help therapy model supported her to be a better professional. Not only this, today I will confide in you all and I will share my own experience. My husband died in the year 2016. It was a very tragic death. So I, at that time, had a full-blown practice with 2 other psychologists, a play therapist, neuropsychologist, a nurse practitioner working under me, and me being the owner of the group, I couldn't stop working. So I did go on a short break for a few months because there were so many unanswered questions which I was trying to find out the answers for with his death, following the stages of grief. And I myself went through therapy to support myself. And that tragic experience really taught me a lot that how my own self-reflection and treatment through a therapist supported me to treat my own patients even till today. We all psychologists at one point of life do go through some life circumstances with strategies and emotions and pain, which we have to learn to heal seeking support, just like we heal others. And by going through therapy and self-reflection, we can grow both personally as an individual and as a professional. So I want to say to all the psychologists out there, don't hide your mental health struggles. Understanding oneself is a part of professional development for a psychologist to be a better psychologist. Lastly, I would strongly request to the community and other people, therapy is not a sign of weakness, but a path to become a better individual, even if you are a psychologist. Like all of us, psychologists are human beings too. Lastly, I would like to say that I would love to have an open discussion on this topic in a live session soon, and I'll announce the date and time so that you all can stay tuned. Until then, if you liked this video, please don't forget to hit the like button, subscribe, and click the bell icon so we can stay connected. It was great to do this piece of recording for you all. Till then, have a good night, have a good day, and have a good happy life.